Hello and welcome to this online learning of Psychology of Injury. In this module, we're going to discuss the psychology behind injury and what our clients may be feeling and experiencing when they are working through and trying to recover from an injury. We will begin the online learning by summarising the psychological effects of sports massage, which we covered in our Level 3 learning. We're going to discuss the biopsychosocial model in more detail and its relationship to the psychology of injury. And again, we covered the biopsychosocial model briefly in your Level 3 learning, so we're going to update that a little bit further and go deeper into that learning. We'll summarise the impact and effects of an injury on athletes and clients and how they feel. And then lastly, we're going to discuss on how we can learn to work with clients and support them positively through their injuries. Here are the main psychological effects of sports massage that we discussed in your Level 3 learning. From the science that we know and the research available to us, we know that sports massage can help reduce depression and anxiety in adults. There's been some proven research based on that. It helps balance the autonomic nervous system, so calming the nervous system, upregulating the parasympathetic nervous system. Massage has been shown to give clients an improved sense of well-being. And there's also some science to suggest that there's a reduction in cortisol, the stress hormone, with massage as well. So it has some really good benefits on ourselves and on our bodies. And as we progress within our Level 4 learning, where we start to discuss injuries and how to support clients through injuries, we need to think about how sports massage can help them from that psychological benefit when they have been experiencing an injury or are currently working through a particular injury. You may have already experienced this within your client sessions currently. If you're working with a client that has been experiencing an injury, they may have been seeing a physiotherapist or another health professional, but they don't feel like it's getting better quick enough, or it comes back, or they've been told the healing time is X, Y, and Z, and it's actually taking a lot longer than that. So you can see how the words that we use and how we talk about injury can have a big impact on your client's recovery, which is what we're going to discuss in more detail in the rest of the online learning. We think it starts with a biopsychosocial model. If you remember, we recapped this within our Level 3 learning. The model was created by George Engel and was a way of looking at a true state of human health and how each of the connecting circles plays a huge part in a human's optimal health. This image in particular was taken from the Explain Pain Supercharged book, which is looking at the model from a pain perspective. But either way, all of the categories around each of the circle need to be thought about in healthcare when we're working with our clients, especially in sports massage. Generally, in health professions, there is a huge emphasis on the bio side of this model. So when clients are experiencing an injury, they will probably be asked a series of questions about the injury itself, how it happened, what happened, how does it feel, are there signs of inflammation, just as examples. At the same time, when it comes to pain, the focus has often been more heavily on that bio side of the model as well. But if you recap from the Level 3 live days when we discuss pain, a client can have no tissue damage and experience pain, which makes you consider the other two circles that create the biopsychosocial model. And as we are discussing the psychology of an injury, you can see how the psycho and the social aspects of this model can impact an injury if injury was in the centre of this model rather than overall health. Another model which demonstrates a relationship with the psychosocial side of the original biopsychosocial model is the biopsychosocial model of stress and athletic injury and health. It is known that in sport that there is a psychological impact to an athlete when they are injured, and this model demonstrates that relationship quite clearly. And it also links the learning you've previously done on injury prevention with the psychology surrounding preventing injuries. What you can see within this model is that there are stresses that can lead to certain outcomes, potentially leading to an injury or prolonged injury recovery, which is the emphasis of this online learning. As an example, some of the psychophysiological factors such as stress can potentially lead to a slower injury recovery, which then can have a bigger impact on the client's or athlete's well-being. As an example, if the athlete or client is stressed or concerned about experiencing injury or how long it will take and the impact of that, it could potentially delay the recovery of an injury even further. Which then leads us to looking at the impact an injury can have on a client or an athlete. Depending on the type of injury, the severity injury, and the type of sport the athlete takes part in, there can be some huge impact and implications an injury may cause or create for that athlete in mind. And here are just some of them. So the first one is a financial implication. What happens if that client, athlete or player can't play their sport for an injury? Do they still get paid? Are they in an employment contract? Are they only contracted for the time that they are playing? So it may have quite a big financial impact on that particular athlete in mind if they are injured. There can also be some strategic consequences for not just the athlete that is injured, but also their fellow teammates or players if they work within a team. Will they have to change play? Are they working towards a certain competition or event that they need all their players to be healthy for? This can have an impact on more than just the player that is injured themselves. And alongside that, if the injured athlete is aware of that, then that could have a bigger impact on how they are feeling and experiencing this injury during this time. Job security can also be a big factor as an implication on a professional athlete. Depending on how long they are injured for, they may be released of their role, which then can have a big personal implication for them. If they do maintain their position or role within their team or within their sport, there's going to be a huge reduction in job satisfaction. If you are paid to play whatever sport and you're not able to do so and you have to watch on the sidelines, it could often be quite challenging to not be able to take part. So it could reduce the job satisfaction that comes around, that comes with working within sport. For the clients that we see within our everyday clinics, some of those implications may not be relevant, but there may be other implications as well. So depending on the type of injury that your client has experienced, there may be some time off work. That time may or may not be fully paid. So there could be then some financial implications of that. There may also be some social challenges for your client as well. Firstly, they may be part of a recreational sporting group, such as a running group or a local football team as an example. And if they aren't able to take part in that sport, it can have an impact on how they feel. At the same time, if they are training for a particular event, personally, I've definitely worked with clients that have been working towards a marathon and have had to pull out for an injury, but they've raised lots of money for their charity place. So it can have a big impact on that as well. But also, depending on the injury that your client has sustained, it may stop them from taking part in social activities, seeing friends and family, doing other recreational activities. So it can have a big impact not just on their sporting life, but their everyday life. Following on from discussing the impact of an injury, it's important to consider your client's or athlete's beliefs about their injury and pain itself. Your client's beliefs can have a huge impact on how they perceive their body, the impact or positive impact or negative impact it can have on their recovery, and their willingness or motivation to do the things they need to do to be able to help them get better, such as home care. Now, when you are listening to your clients, start to take notice of the things that they may say, short sentences that may just pop up throughout your sessions. And here are some of the examples that I've definitely heard within my practice, and Pentony has also. I will never be able to play sport again. And you can exchange sport for running, play golf, play football again. Back pain happens when you're older, I just need to accept it. And that's a really common one. People think as they age, back pain is inevitable. Their spine is a crumbling spine and it's going to be falling apart as soon as they get over the age of 30. They may have been told things by other health professionals. Common ones are, I've been told I've got a weak core, which is why my back hurts. And again, you can exchange weak core for anything hurting, weak quads, weak glutes, weak chest, weak shoulders, whatever it might be. They may have been told that by somebody at some point, and they've retained that as a belief about their body, which can negatively impact their perception of their body, but also their recovery. Another classic example, I've been diagnosed with degeneration of the spine, so back pain is just a part of that. If we think back to the injury module where we discussed bones and then other structures, everyone over the age of 25 has some sort of degeneration of the spine, but doesn't necessarily mean there will be back pain that is present. But again, it's a belief that the client has heard. It's important for you as a therapist to start to notice and start to listen to the beliefs your clients have, because what you can do through your treatment, but also what you say to them, can have a positive impact of changing those beliefs. We've discussed the impact an injury can have on your client or athlete from a social scenario, from a financial scenario, but there's also the effect on their mental well-being that can make a huge impact on how they recover from an injury. Some of the effects are things like anxiety, so worried about what's happening to their body. They may start catastrophizing, so they may start thinking their injury is bigger than it actually is, or it's going to really negatively impact their life for a very long time. There's been some research to suggest that during injury recovery, some of the effects are a greater mood disturbance than previously. Sleep can also be affected. Other effects may be depression, which again links with the anxiety that clients may be experiencing, and also lower self-esteem if they're not able to do their chosen activity or sport that they love. What is interesting is that some of these effects that your clients may be experiencing when they can't do their activity or sport can also negatively affect their injury recovery if we go back to the biopsychosocial model focusing on athlete injury. So it can be a double-edged sword in a way if they are experiencing an injury and then stress and other negative effects impact themselves by not being able to do their activity or sport. That can also then negatively affect how they recover and the speed of their recovery from injury. And this is where us as sports massage therapists can come in and really support them through this time. And now let's move into our role as a sports massage therapist and working with clients through an injury from a psychological perspective. There is a lot we can do as a sports massage therapist to help support our clients through an injury. But as with everything, if you think your client needs some medical support, it's always really important that you refer on, and that might be back to their GP to get some talking therapy to help them through the injury process. We aren't therapists, we aren't counsellors, but we can listen to them. But it's always important, if you think they need that extra help, refer back to their GP. These are the 5 areas we're going to focus on for the rest of the learning. We're going to look at actively listening, empathy versus sympathy, how to reassure your client goal setting and expectations, and education. The first one is active listening. We discussed this in quite a lot of detail when we looked at subjective assessments and objective assessments on your level 3 sports massage course. But it's always good to recap, because this is really important to help your client start to feel better and help them on that journey of injury recovery. And the 7 things that you can do to make a difference. So you can firstly be attentive. So focus on that body language, good eye contact with them to show and demonstrate that you're listening. Think about all those open-ended questions that you want to ask them to really get to know them and find out about them. Your client is the most important person within this, and they are also the expert of themselves. It's really important that you focus on listening and ask as many open-ended questions as you can to get as much information about them. You can ask those probing questions if you want to get more information about them, so get them to delve deeper into how they're feeling, what they're experiencing. And that then leads into asking for clarification if there's something you're not quite sure about what they've said. A way to do that is to paraphrase. And that's when we use the example in the subjective assessment to say, so you said you've been experiencing X, Y, and Z, and you've been feeling like 1, 2, and 3. And that's just demonstrated to them that you're listening to what they've said. Be attuned to and reflect feelings. And that links with the empathy slide, which we'll discuss a little bit later. And then finally, summarize exactly what they've said before you start to go through the plan of action into the objective assessments. And all of that combined is a really good way of demonstrating that you're listening to the client, but also you're definitely listening to the client because you're getting all of that information that you need to help create the best treatment for them. Next is empathy and reassurance. And the difference between empathy and sympathy is that empathy really gets into the shoes of your client to really deeply understand how they're feeling, rather than just demonstrating that you know how you feel or providing a bit of pity or sorrow for them instead. So it's a deeper level of understanding. And that's really important for client relationship building, but also to help them have a positive experience on the treatment, which again, as we know, can make a big impact on their injury recovery. Linking in with that is the reassurance and offering reassurance to your client throughout your assessments and into the treatment as well. So focus on that positive language, positive words and phrases that you can use, and avoid anything that may negatively impact their beliefs, because you want to be positively impacting their beliefs about their body. The simple thing of avoiding using the words pain and tight and sore can have a huge positive impact on them. It is important that we provide really good and clear patient education to all of our clients. Always use simple, easy to follow language that your client will understand. Avoid any of that technical jargon. But always start a conversation with a question such as, would you like to know more about that? Sometimes clients may say no, and that's when you stop. But sometimes clients may want to know a little bit more about what may be happening for them, and that could be a positive part of their recovery. But it's always important to ask them before you offload information to them. I love this image from the Explain Pain Supercharged book. So you have this iceberg, and underneath is what you need to know as a therapist. So that's all of the theory learning, all of the practical learning, all of the client experiences that you've got. But actually what you need to pass on to your client is actually really small. It's important that you focus on thinking about that iceberg when you're working with your clients. Ask them if they'd like to know more about what might be happening for them, but be mindful about the information that you provide. Following on from education is setting expectations and goals with clients. And it's amazing actually when clients come into your clinic and they have an injury, they may think that their healing time is far shorter or far longer than what we think may be happening for them based on tissue healing times and all of those other factors. But it's really important that you set clear goals to begin with, because then that can help increase your client's motivation, but also help them understand what's happening for their body as well. Focus on client behaviors and goal setting rather than the tissue healing times, because everyone's healing times will be different based on all of those factors that we've discussed previously. So it's important that we focus on goal orientated markers based on behaviors. So it might be doing a certain exercise for a certain period of time, adding relaxation or breathing strategies throughout the week, whatever it might be. Focus on behaviors rather than expected healing times. I love this diagram. This is from Adam Meekins, who is a physiotherapist, and it was printed within the British Medical Journal. And image A is what clients often think healing time and the healing journey will be like. A linear straight line gradually gets better, nice and easy. But what often happens is it gets easier, gets worse, gets a little bit easier, gets so much worse. It can change and vary day to day, week to week, which clients don't always expect. What's interesting about this diagram, you can see the arrow goes back in time. And this is really interesting because I think it perceives what the client experiences in real time. Your clients may say to you, I feel like I've gone one step forward and two steps back, and it's gone worse than it was when we started. And that's kind of a natural healing journey or an injury recovery journey for most of our clients. And finally, the last thing that we can do as sports massage therapists is provide some really simple exercise and movement guidelines for your clients that are experiencing injuries. So think back to that Peace and Love acronym. These are 20 things that you can do or suggest with your clients to help them keep moving, to stop them from avoiding exercise and avoiding activity throughout their injury. So I won't read them all out because there's lots of text on here. So what I would suggest for you to do is to pause the video and to read this yourself. I will also provide the link of where this was found within the online learning as well for further reading. And for even further reading, here are some of the references used in this presentation.